Welcome, everyone. I'm Dr. David P. Winchester, retired past medical director for cancer programs for the American College of Surgeons, which one of the central programs, of course, with the Commission on Cancer. We're celebrating our 100th anniversary this year since we were founded in 1921. And I'm really happy today to introduce Dr. Charles Balch, who is a well-known, internationally well-known surgical oncologist and a real leader in the surgical oncology world and other worlds as well. And we're going to spend a few minutes talking today about the Commission on Cancer, and particularly about Dr. R. Lee Clark, was one of the forerunners and inventors, not the inventor of the commission, but many of the programs of the commission. And he was a giant in surgical oncology. And so with those remarks, the brief remarks, I'll turn it over to Dr. Balch and ask him to make some comments.
Sure. I'm Dr. Charles Balch, and I'm pleased to be on this program with my friend and colleague, Dr. David Winchester. I've been involved in the Commission on Cancer and the AJCC for many years. I was chaired the executive committee when Richard Wilson was the commission chair, and have also been involved on the executive committee of the AJCC. At the present time, I've been doing a lot of historical research on Dr. R. Lee Clark in preparation for a biography that we're writing on him. So I have a lot of detailed information from his personal records about his role, which I think is underappreciated in leading the strategies and the visions of first the Committee on Cancer, and then he personally made the recommendation and named the Commission on Cancer in his recommendations in 1964 to the Board of Regents that was approved the following year.
That was a really important step. And, you know, Dr. Clark had many contributions to the American College of Surgeons through the Commission on Cancer. I just want to briefly point out that he was the one who really invented the MD Anderson Hospital and built that hospital, which has been called the something like the
Pink Palace of Healing.
The Pink Palace of Healing, yeah, right. It's pink marble from Georgia. It's very distinctive, but he's done so many things for cancer patients through the years and for the Commission on Cancer. And the commission has grown tremendously since his time, but we owe our thanks to R. Lee Clark for getting it all moving along back in the 50s and 60s.
And David, maybe as a preliminary to our discussion about the committee and the Commission on Cancer, it may be important to point out that Dr. Clark first became the director and surgeon in chief in 1946, 75 years ago, at MD Anderson. And part of his early programs for the state of Texas was having a registry of information. He actually reported in 1960 on the results of their first 40,000 patients that they treated with survival rates. And he also believed that every physician in Texas should be a diagnostician for detecting early cancer. So instead of having a philosophy of everybody comes to the ivory tower at MD Anderson, he had a philosophy of improving the care at the community level, first in Texas, and then he brought that philosophy to the Committee on Cancer, which he was named in 1947. So he had 23 years of involvement, first on the Committee on Cancer, and then the Commission on Cancer, and for which he received in 1969 the college's Distinguished Service Award, given to one person a year for their substantial contributions. And in this case, it was Dr. Clark's contribution to the revitalization of the Committee on Cancer and leading it to a point that it could become the Commission on Cancer.
He was instrumental in many of the things you have mentioned, but one of his early emphasis was on screening mammography for breast cancer, and he popularized that. He also brought in other organizations in the Commission on Cancer, not just the surgical organization, but he was big on radiation therapy in the early years. And now, as you well know, the Commission on Cancer has 55 or 60 national organizations, including the National Cancer Institute and many, many others.
Lee Clark was an organizational genius. When he started MD Anderson, he started for the first time the team approach to cancer and embraced the concept of multidisciplinary care with what were called at the time internists and radiologists. They weren't specialists at that point, and surgeons working together for breast cancer, GI cancers, and so forth. And he also took that at the national level by embracing other organizations, the American Cancer Society, the College of Radiology, the American Hospital Association, the Association of Registrars, in order to have an organization that represented everyone so that they would have the credibility for their accreditation, meaning something not just for the surgical community, but for all specialists who treat cancer.
That's great. He was instrumental in doing that. And I must be regretful in announcing that he passed away in 1987, I believe it was, at age 90 or 87. Ironically, it was from colon cancer, after colon cancer surgery and then complications.
Specialties.
Right.
Yeah, one other point to bring out here is Dr. Clark not only was keen about bringing national organizations together, he wanted to bring international organizations as well. He worked very much with the leadership of the UICC, and part of what happened in that time between his being committee chair, 1959 to 1964, was to bring in the UICC so that jointly the AJCC and the UICC were trying to have a common language for the staging throughout the world, not just in America.
He was really an agent of change during his years on the Cancer Committee and the Commission on Cancer. And actually the Board of Regents of the American College of Surgeons early on did not really embrace everything that he was pushing for, including going to the Clinical Congress and running the cancer part of the Clinical Congress. That was rejected. But Dr. Rabden, the chair of the Board of Regents, eventually came around and realized the value of everything he was doing. And certainly the Board of Regents, as you mentioned earlier, passed the concept of making the Commission on Cancer the name and making it a community-based organization with many, many hospitals being approved through the approval program.
Yeah, I think it's important to point out to our audience the philosophy that drove his organizational genius. And I have in front of me a letter that he wrote in 1952, where he said there's a great discrepancy between treatment of cancer and the medical centers throughout the country and the care of the cancer patient in the average community hospital. Even if we simply apply the knowledge at hand, we should in the next few years double the salvage of patients with malignant disease. And I would suggest, this is in 1952, that one of our chief objectives and themes will be the improvement of the care of the cancer patient at the community level. And that our second objective should be the reestablishment of the American College of Surgeons as the leading professional group in both cancer care and cancer education in the United States. So this is the philosophy that he brought to the Committee on Cancer that made all of these changes over really a decade that ultimately led to it being justified as the Commission on Cancer.
Right. That's so true and so well said. But he was a real visionary, and we were fortunate to have him as one of our leaders at college.
I wanted to amplify three specific things he did on what is now the Commission on Cancer that were his ideas that he led and then assigned people to carry out and implement those. So the first was the AJCC, for which his friend and colleague Murray Copeland, he was assigned. Murray Copeland gets the credit for being the first chair of the AJCC, But here's what Lee Clark added to that, and that was the end results reporting. It wasn't good enough just to stage cancer. He wanted the registries to follow up for 5-year survival and report their results, especially at the community level, so they would see how they're doing compared to other colleagues in their regions, in their state, or even nationally. So the end results was an important part of what he added to the AJCC, and even promoted that at his own institutions, reporting end results at an early time. The second thing he did was the Regionalization Program, for which he assigned Ashbel Williams from Jacksonville to be the lead in that. He talked about, we're not going to know what happens at the community if we just report on the results from what he called those ivory tower institutions.
Right.
He wanted to have representatives from every state of community surgeons and internists and radiation therapists to organize at the state level, again, working with the American Cancer Society at the state level also, so that there would be a regional program that wasn't just a national program trickling down, but a local regional program that would embrace the unique features of cancer patients in their local community. And then the third thing that he started in 1962 was the Accreditation Program. And that was, you had to have a tumor registry, you had to have a multidisciplinary group of people working together. And this was very new at the time. Surgeons, internists, and radiologists, pathologists, and radiologists, and he specifically named them as part of the cancer team at each hospital, so that they had registries, tumor boards, and educational programs, and also that they would, this criteria would be part of the American Joint Commission for Hospitals. So if you're going to be accredited for the hospital, you also had to be accredited for these cancer programs. And that gave teeth to the program, because all hospitals, even at the local level, want to be accredited. And he started to put the teeth and the criteria in this so that the excellence of multidisciplinary patient care would be implemented and reported out at the local level.
Good. Well, I think we're going to have to conclude this program, and I will do so by thanking Dr. Balch for his monumental efforts here and in tracking the greatness and all the accomplishments of Dr. R. Lee Clark. I hope the audience has enjoyed this and has learned more about the genesis of the Commission on Cancer and its tremendous programs in improving cancer care. So, Charles, I want to thank you very much for your contributions, and say good night or good day to the audience.
Thank you. It's a pleasure to be here with all of you as we celebrate the 100-year anniversary. The Commission on Cancer and the American College of Surgeons, and even at the same time, the American Cancer Society had its birth at that time also.
Which Lee Clark was president of,
Yes.
by the way.
Yes.
Thank you, everyone.